uh, although we are not doing the FGD, but I'll take a session on FGD because FGD is again a good data collection technique. So this if now there are other methods of data collection. So there are various methods of data collection in qualitative research. First is the in-depth interview, which we have just seen. There is another method, which is the participant observation, which we have not talked till now. When you observe it, like especially in ethnography, which we discussed yesterday, like active versus overt versus covert, active versus passive ethnography. Third is your this FGD. So FGD, what is this focus group discussion? So if you have any question, it depends on your research question. So if your research question is something like, why do people opt for a treatment in a specific hospital? Or why do people choose for any treatment options? Why do people get impatient in hospital? So here you will see that everything is belonging to people. So in such case, or why do first year students get adjusted? How do first year students get adjusted in hostel life? If something is of this sort, then what you can do, you can, because it is related to a group of people. In that case, these are some other questions like residents cope up with their stress, the barriers in accessing healthcare for autistic children, or how do families decide about availing treatment for childhood diseases. So in all these questions, you will see that you want to, all these questions are asking for people preferences. And here we are talking about group. So that's why if your research question is involving something of this sort, then you can have a focus group discussion as a data collection method. So this focus group discussion is about a group opinion. You, at the end, generally what you desire that there should be, you should come to a conclusion. So it is basically the purpose is to explore how a particular group of people or how people think on a particular research question or a particular topic cohesively. So that's why the group opinion matters. And in that context, FGD is a better option of data collection as compared to the in-depth interview. Suppose you are doing something over the curriculum with the medical students, and if you wish to know like what part should be there, what all we should delete it, or the way we are going about their medical education or about their curriculum, then conducting an FGD with a group of students is a good idea rather than doing in-depth interview. Again, if you are doing some program evaluation of Anemia Mukt Bharat, then you can call all the stakeholders and you can do a focus group discussion in such cases. So now you can see there are two pictures in this slide. So what is the difference between these two pictures in terms of group interaction?
There is no interaction occurring in the first group. It's only the interviewer who's talking to the remaining.
Yes.
Whereas in the second group, there is a multi-dimensional interaction between the interviewer and participants also.
Yes. Rightly said. So the first one is like one person is talking to everyone, but the participants are not talking with themselves. So that is basically this one. If you see, this is what is the name of this data collection method? This one?
Group interview.
Yeah, true. This is a group interview. And this happened with us during the RSV because the vaccine uptake of this respiratory syncytial virus vaccine, initially the data collection method was FGD. We plan to do the FGD with the ANM and ASHA, FGD with the mothers, But when we started doing it, because before that we had to check that whether it is feasible or not. So what happened that there were many, like if you 6 to 8 mothers we invited, then there were kind of like 6 to 8 mothers, and there was a second row and third row of people in the PHC. Everybody, stood there in that group, and everybody was like talking in between, and they were not, everybody wanted to interact with the main person with the interviewer. Nobody was talking to each other, since the place was, we could not get a very good place where there should not be any interruptions. And so that then we thought that let's convert it into the in-depth interview, because FGD was not possible, uh, and the data which we were getting, that was a kind of like a group interview. Every person was talking to the main person, and they were not interacting with each other. So that's why many times it happens when you are pilot testing a guide or you are pilot testing a research, then you need to change your methodology also, because if something is not possible, especially in such field-based project, then you need to change your data collection method. So for FGD, like for alcohol project, we could successfully conducted the FGD, but for this project, since it was very difficult. So why to do FGD? So FGD is like as a cheap source of data. How many FGD is needed? So even if there are 4 FGD, that is okay. And the duration, of course, it should be like we have seen, the transcript should be rich. Many times what happens that when you are doing triangulation, you take like three. Yesterday we have seen, like if you are taking multiple method of data collection, you do the participant observation also, or you take the some secondary data also, or you take the in-depth interview and you do the FGD also. So that can also be done, that it can be like a alternative, not as an additional method of data collection. Again, like we have seen, it can be a way to develop a survey questionnaire, or it can be there like mixed method as a validate the finding of a quantitative research. And it can be a part of multi-method qualitative research, like we have just seen, interview with the in-depth interview and with the participant observation, or with the taking the secondary data and in-depth interview. So what is not a focus group discussion? So moderator talking only to one person dominating, and no group interaction. These three are not the FGD. So in focus group is basically the researcher adopts the peripheral role. He only starts the moderation, and then the participants, they interact with each other, and there is a interrelational dynamics. Whereas in group interview, the researcher adopts a investigative role, and researcher controls the dynamic of the group also. But again, group interview is also important. I think Rajat, did you go for that RNTCP qualitative evaluation?
No, ma'am, for that I did not go.
Okay,
But for
okay.
RSV, as you told, we tried in the urban health center Kagol, but it was not successful. Then we converted it to the in-depth interview.
Okay, so what was your experience? Can you share?
There's a lot of disturbance, ma'am. We were in urban health center, so there's a lot of disturbance, and the people who are not a part of the focus group discussion, they also were interrupting in between. So as you said, we didn't had any enough space and to sit and conduct the interview. So me and Dr. Neha Chaudhary, ma'am, we had gone for this testing of the FGD. Then based on the feedback, we changed later to in-depth
Okay,
interviews.
okay, thank you. Ria, did you go for that RNTCP evaluation? No, okay.
RNTCP evaluation? No, ma'am, I didn't go.
Okay, okay. So I think the Purushottam was their resident who went for RNTCP, and there I think they adopted some method of doing the group interview. That was one of the quantitative method.
Ma'am, I'm interrupt, ma'am. It was nominal group technique. It was for the subnational certification,
Okay,
where we were giving them a question, ma'am. Like for example, what is the coverage of anti-TB drugs in your area? So, and we
okay,
had a mixture of people there in the group. So one
okay,
was from the pharmacy side, one was from the administrator side, and one was from the respiratory medicine side. So we had a varied group of people, and based on their responses on spot, we used to write the coverage. For example, respiratory medicine consultant used to say the coverage was around 80%. And pharmacist, based on the prescriptions, what he found, he used to say it is around 90%. So
Okay.
then they all used to come to a consensus. So
Okay.
based on the consensus, the percentage would vary every time, ma'am. So this we did for 2 to 3 rounds. And then final, whatever the outcome came, the percentage, that everyone has to again come into consensus. So that would be the final result. So for this, we did for so many questions. They called as nominal group technique, NGTs.
Okay. So that was again like a kind of mix of this qualitative versus quantitative, where you are trying to have a group consensus, but not the perspective basically. So thank you, Rajat. So now coming to this participant selection, again, like we have said in the in-depth interview, it is purposive. So moderators and facilitators are there. So they keep the members on track the way we have learned for in-depth interview. You should encourage all participants to speak. If someone is not speaking, you should encourage him to speak. You should keep eyes on time. Why? Because it should not be too much of duration, like 1 hour, 1 hour, 50 minutes. Because in alcohol, because alcohol is such a issue that everyone was talking. So many times, like one interview got recorded for 1.5 hours, and then we had to delete many sections which was not relevant. So that's why we should keep eyes on time, and because we are the doing the main lead and main facilitator of this FGD, and we should try to cover all questions. So there should be prior plans for conducting FGD. You should identify the participants. Always recruit more participants, because there will be last minute changes. They will inform that such and such is ill at home, I cannot come. So if you have to take 8 people, invite 12 to 15 people. And then arrange logistics for FGD. Generally, there should be arrangement of snacks and interview guide we have discussed. So this again, video recording versus audio recording. This video recording, if you are doing video recording, that is equivalent to audio recording plus notes, because you are seeing the non-verbal part also in case of a video recording. It is the best choice, but again, because people have a problem in audio recording also, video to generally they don't allow. And you need a large setup also for video recording. So this is one alternative. Again, the same, you should welcome the participants, introduce the topic the way we have done for this in-depth interview. These are some common things. Just you should watch this video of one focus group discussion and keep on mentioning the points the way you have done for the in-depth interview.
The moderator is about to begin the actual focus group. This introduction is short and snappy and covers 4 points: a welcome and introduction to the topic, some background on the topic, ground rules for the focus group, and the opening question.
Well, good afternoon and welcome to our session. My name is Dick Kruger and I'm with the Happy Traveler Research Agency. And we're pleased you could all join us today for our focus group. We've invited you to join our discussion on airline travel. Today, we're going to be talking about experiences that you've had in traveling by airplane. Experiences that within the last few years. We're going to be talking about things that have worked well for you, things you've enjoyed, as well as things that haven't gone so well. This study is being done at the request of the airline industry. As you may know, people have had a variety of experiences, and airline industries regularly are trying to improve the quality of their service. And so at the end of our study, we're going to be sharing information back with them. Also, if you're interested, we'll have a copy of the report available to you as well. Let us know if that's something that you're interested in. You were selected because you were among a group of people who have traveled fairly often over the past few years, and we're glad you're here for our group. As I indicated, my name is Dick Kruger. I'm with the Happy Traveler Research Agency, and my colleague is Mary Ann Casey, and she'll be taking notes and helping record the conversation. We're going to be tape recording today. We have a microphone in the middle of the room, and then we tape record so we don't miss any of the comments. Oftentimes people say things so well, we're not able to write them down quickly enough, and the tape recorder helps us capture those. There's just a couple ground rules that might help us. If you have a cell phone, we'd appreciate if you'd turn it off or turn it on the quiet mode. If you do need to respond to it, please step out, but then come back in as soon as possible. We have more refreshments and some chocolate over there at the side table, so help yourself to that whenever you feel a need for those things. There are no wrong answers today in our conversation. Many people have different experiences with airline travel, and so feel free to comment even if your thoughts and ideas or experiences are different from what others have to say. My job is to guide the conversation and to keep us on time and be sure that we finish at the end of our allotted 2 hours today. And so along the way, I may interrupt, I may push us along a little bit faster. That's so that we can finish our conversation on time. Well, let's take a moment. Also, by the way, we're going to be on a first name basis. We have name tents with our first names on. Let's take a moment and go around the table and find out who you are, and would you tell us your name, and then also tell us where you've traveled to by airplane in the last year, and would you name some of the cities that you've traveled to, and would you start?
I'm Jim Brown, and the last year I've traveled.
At the beginning of a focus group, most comments are directed directly to the moderator. But as the focus group continues, the moderator will try to get people to look across the table and speak to the other participants. This is a good sign and something to be desired in your focus groups. One of the effective techniques of moderating is to use a short pause, usually about 5 seconds. This allows participants a chance to reflect and think and a chance to express their thoughts.
Okay, well, let's get started with the questions in our focus group. The first one, and we're not going to go around the table, and anyone can answer this who chooses. Tell me this. What do you like about airline travel?
Oh, I can start, Dick. I like that it gets me between two places relatively quickly.
When moderating a focus group, you'll find that some people talk too much and ramble on about a topic, and you'll need to have a strategy for how to deal with this. Here's an example of what you do when a person talks too much and how the moderator redirects the question to another participant.
All right, well, let's talk about inconveniences. In your experiences with airline travel, you may have encountered an inconvenience. May have been in the last year or a little bit before. Would you tell me about an inconvenience you've had?
Well, let me tell you, it's always around baggage, and it seems to me that there's always something that happens with my baggage when I travel. I was coming back from Bangkok. I was meant to get my baggage in LA to take it through immigration, and when I got there, couldn't find it anywhere. It just wasn't there, and I stood there and stood there and stood there, and I went behind the counter to the counter, and they said, well, you know, it's just not there, and it'll turn up eventually, and maybe it'll turn up in Minneapolis. But it's just been one long string of things after another. I mean, the baggage is always too large to fit in the overhead bin, but it's even worse when you're traveling by train, because when you're traveling by train, you have to get the baggage up from the platform, and then you have to haul it into the coach, and then you're pulling it all the way down the coach in order to get to your seat on the train, and there's never anyone there to help.
Yeah, that can be a problem. Let's hear from some others in the group. Francis, how about you? Have you had an experience with an inconvenience?
Well, I haven't had a problem with luggage because I always...
Sometimes participants do not talk very much in a focus group. One of the strategies that moderators can use is to look at those individuals and at times call on them and invite their comments. Here's an example of how it works.
Sherry, we haven't heard from you on this. What are the things that you don't like about airline travel?
Well, mostly two things, luggage and children.
Tell me about each of those. Tell me about luggage and tell me about children.
Well, with luggage, you never know if they're going to accept your carry-on or not. In some airlines, even in the same airline, sometimes the carry-on fits. They say it will fit in the overhead, and other times they take it away from me, and then I have to check it. So even though I think it's standard size, sometimes it doesn't.
One of the things that happens in a focus group is there are key moments when people start to own the group or feel like they are a group and in a discussion. Here's an example. When these things occur, moderators often encourage these and allow people to talk across the table to each other.
All right.
You know, I want to say something else about luggage, and it relates to when planes are late. You never know if your bags will make it. And sometimes it's not your fault. You've checked it. You've done what you're supposed to do, and then they mess it up, and then you get there. You don't have, so I carry now a lot of things in my carry-on because I just have to assume it won't make it.
I never check anything. I always carry on. Never check it.
Because you just can't.
I never trust it.
So this was like a
The moderator is
focused group discussion. So I'm not going to discuss these do's and don'ts. I think you all know these things. You can go through this. Again, group interview we have discussed. So generally this is important. We all know that FGD should be a choice of data collection when you need assessment or program evaluation, or you want to know about the opinion of a group as such cohesively. And where should it be, like if you are exploring the norms of practices about the group consensus, or if you are not there are situations where you should avoid these FGD. And these are situations like if it is a sensitive topic where the people are not comfortable talking openly, or something related to stigma, their personal experiences like phenomenology and narrative, which we have seen. If something related to those personal experiences there, then you should not do FGD, because then the people will not come up, and it will be like more the social desirability bias, which you guys were talking, that will come into play. So I think that's there with the FGD. Group size and number of focus group. So 80% themes are generally there in 2 to 3 FGD, and 90% theme or 90% there will be saturation in 3 to 6 FGD. And if so you can say like roughly 3 to 4 FGDs are enough to identify most prevalent theme. So situations where we should avoid FGD: when group is not talking, when meaning, whatever meaning they are saying, it is not very clear, and there are people pleaser in the group. They are saying everything to make you happy, and they are not coming up with their own own consensus. And whenever there are in FGD, what happens, like there are people who beyond your participation, means beyond the people who are there in the group, when there are other people or also there is a contamination, then also you should avoid. When there are dishonest responses, when there are dominant people who are leading the discussions, and when there is this time, effort and money is more than the in-depth interview, then also it should be avoided. There was one question from Dr. Praveena that if we are planning to conduct only 2 FGD with 8 participants each and have logistical support for only 2 groups, but if more invitees show up, how can we manage the situation? So first thing is, even if you have like incentive, don't say that prior that incentive will be there, because then it will be too much of selection bias will be there. We want purposive sample, but we don't want purposive only for people, for the sake of money. So there should be someone who wants to clearly and who wants to openly share his or her opinion or viewpoint. So in case of that HIV study also, we did not say to the participants beforehand that we will be giving them some incentive. That's only after the completion of interview. In fact, many of them were not ready to take. They were like, no, I don't want to take. But yes, you don't commit this money thing, not even to Asha, because then what Asha will say, she will go and she will convince everyone that you will get 500, you will get 1000, please come. But don't do, and she will only select people like who she wants to give the benefit. So first thing is this, right? You should not commit these support initially. The second thing, yes, it should not, no, it should not be mentioned, because it's only that if there's generally if there is a wage loss or travel support. So you don't give, you only giving it in the form of a travel support. If something, or their time, you took their time like 2 hours and
Yes,
there will
ma'am. Actually, we are doing that, ma'am, because we are planning to do a study on transgenders. So we will be approaching through the NGOs or transgender leaders. So they actually state we have to compensate for their time. So anyhow, the participants will be informed that we are going to give them minimum rupees 500 rupees for their time for these FGDs or interviews. So how to overcome in this situation, ma'am?
in this case, probably it is difficult in the sense saying this money thing you are saying.
Yes,
Or
ma'am.
the FGD, if other people come. There are two.
Both, ma'am, actually, because if we don't mention that we are going to give some incentive, we are not sure whether people will spend their time for this FGD or other things, ma'am. So shouldn't we mention that, ma'am?
No, no, no. I will not, because I know that if you talk to their leaders, if they you say that yes, we will try to compensate for the loss. You only say some indirect sentences. Why? Because we also did on that palliative care. We did not commit to them, the transgender, that leader of the transgender, that we will give the money. But once they were here, and since it is only two, I don't know how much you planned. We conducted two FGD. So that two
Okay, ma'am.
FGD, we could manage, like saying, not saying this that we will give. We said that yes, we will try to compensate one or the other way, but we did not mention about the money. And then we have, so you can say that, some compensation will be given. If you commit like 500, then, there will be people, I don't know, it will be difficult for the people, because now everyone will be, wanting to be a part of that study. And you cannot take more than 16 or 8,
That's
like.
what, ma'am. How to avoid them, ma'am? Actually, if around 20 people have been gathering in that place, but we want only 16. So how to avoid or how
You
to
can say, so yes, I think you can take help of their representative, and they will convey that people who are there, who have not been invited there, they can be an observer, but they should not rather they should not be participating in the interview also. That is there, like, even and you can say to them that the incentive will, I mean, they will not be compensated since they were not invited. They came on their own, or probably because you are going to their place, or you are calling them to your place.
we are going to their place.
Okay,
Or
so
they will be called both the ways, ma'am. They may be called to the NGOs or we may go to their place also.
okay, so if you go to their place, then again you will have to make arrangements for not letting the other people come in. First thing is this, you can select an other place also, where only selected number of people will come. Because we conducted here at AIMS in our seminar room. Why? Because if you call them to your place also, they feel good. Otherwise, they feel that, since we are stigmatized, so they don't want to call us there. So probably we got very good responses from them, since they were very happy sitting in the seminar room of the medical college and getting the treatment. They have never thought like they will be treated like this. So they did not ask for money also, but we definitely compensated. So what you can do, first thing, you don't write that you will give money. Maybe you can only say that some form of compensation will be given to them for the loss of, I mean, because we are taking their time. Second thing, you talk to their leader that you only you require like 8 people. And if somebody else is there, because it is not budgeted, so it is your inability that you cannot compensate. since you have not invited them. You have to clearly communicate because you are not going to give it from your own pocket.
Yes, ma'am. Okay, ma'am. Thank you, ma'am.
Okay. You're welcome. So after this, we'll see the transcription, how to do the transcription, since I think many of you are in this process, but I will quickly go through this process because people are here at different levels. So that's why those of you who are learning this for the first time or maybe second time, we are covering this topic. So what are the basic concepts of transcription? So you have seen the log and you have saved all the interview files in your desktop in a separate folder, and you just do it as a password protected file, because in the ethical consideration you have written that all the interview that audio recorded tape will be in a password protected folder. So now how are you going to do the transcription? So transcription is like there's a exact verbatim and there's a clean verbatim. So exact verbatim is like if there are some emotional thing also, non-verbal part also, but that exact verbatim can be done only if you do the transcription the same day or the next day, because then you remember. But if you are doing it later or if you are getting it done from some other person, then I think clean verbatim is better. And generally our research, mostly, I don't know with all the people, but generally in community medicine, most of the research is related to the health system or related to the services which they are getting. So in that case, we need the clean verbatim. So yes, this is one question, and you will also face this like time. You can see, like if you're transcribing 1 minute of audio recording, how much time it takes approximately. Yes, please type in the chat box.
5 to 10 minutes.
Yes, 10 minutes. If it depends again. If you are doing it in the first time, if you are very good in doing the transcription, then it may take 5 minutes. So lower 5 to 10 minutes. So it's a very boring task. Boring means like it's a time taking task. So you have to sit for long. And again, if you are doing a 1 minute of video recording versus 1 minute of audio recording transcription, which will take more time, video recording or audio recording? So audio recording takes less time. Yes, Dr. Priyanka, you are right. Video recording takes more time. Why? Because you have to see and listen both. And in non-verbal also you have to capture. So video recording takes more time. And now what are the steps for doing this transcription? So we have shown you this format. So on the first page, you should fill up these data like name of the respondent or code, date of the interview, date of the name of the interviewer, site, note taker, facilitator, transcription and translation done by whom. And then on the second page, there should be summary of your interview in 500 words. And if you are like, this is the question, like if you are doing the transcription and you are stuck at some point in the recording and you wish to revisit that point later, how will you proceed further? So we have shown you like something is not clear, then in the bracket you write like dash dash dash. Again, if there is a particular point in a recording that you plan to return it repeatedly, then you in the bracket you write the timestamp. Timestamp means it happened at which time. Maybe at 3 minutes 30 seconds, something is not audible or something is there which is not clear to you. Maybe some local term is there, or maybe something is there which you are not, which you cannot decipher. In that case, in the bracket, you put that timestamp. So that if the other person is checking, if you are asking your friend or your mentor or maybe a social worker to help you in identifying that particular word or sentence, then through that timestamp, you can go and check that. So timestamp is very important. So how should you transcribe an interview? This we have seen. 0 to 5 and like approximately 0 to 5. It's not exactly. If some sentences ending at 4 minutes 40 seconds, you can end it here, and then you can start from 4:41 to the next section. So we divide it in section because it is easy to do the quality check. And if something is not audible in the transcript, you can write in the bracket not clear. So this is just an example of a quantitative data. So this is a quantitative data set 1 and data set 2. So what is the difference between the data set 1 and data set 2?
Missing values.
Yes. So in the data set 2, you can see a lot of missing values. Similarly, in transcript, if a transcript is like this, where the interviewer is saying 1 or 2 sentences and respondent is saying, one paragraph, it is a full data. But if the interviewer is saying 2 to 3 sentences, the way you have seen the first in-depth interview, where you people wrote that, interviewer was talking most of the time and respondent was not talking at all. So this will be like a missing data, because we have learned that in qualitative, the words are the data. If there are no words or if there are less words, it is you have to treat it like missing data. So that's regarding the process of transcription. So let me see what else is left. Interview quality we have seen, and then I think we can discuss, I think 10 minutes before we go for this coding, because now the next is the coding. So you have till now, we have seen the type of research approach. We have seen what are the perspective, the multiple realities, all the 4 worldview, and what is the deductive versus the inductive framework, which was the yesterday's session. And then we saw what is how to develop an interview guide. You all have developed interview guide. Then today's we started with learning how to take the methods of data collection. So in the data collection method, you have seen in-depth interview, you have seen focus group discussion, and then there are participant observation also. And now once you have collected the data, done the transcription and translation, because generally the interview, we take it in the local language, and then we do the translation in the English. So once you transcription translated files are there with you, then you start the process of data analysis. So data analysis, before we go to the data analysis, we need to understand what is coding, what are the different types of coding methods, and how to do it in the QDA minor. So I think 2 people, Doctor.
Audio दो ही आया, बाकी audio बोलिए भेजने।
Okay.
Save it in a drive and उसके बाद share करेंगे।
So we have received audio of only 2 people, 2 team. What about others? How many of you could record it? Yes, can you?
Not what I do.
Ma'am, I recorded, but it is in Mac, so it's not opening. There's some issue with the formatting, so I don't know how to share.
Okay. Okay. And what about other people?
I have recorded, but due to maximum size of file, it should not be shared in WhatsApp. Maybe I will share in mail.
WeTransfer. So do you know how to send it using WeTransfer? WeTransfer or
next बोलिए।
Or anybody else? Nitin, Dr. Nitin has also written recorded, but I'm not sure for formatting it in.
जो वहाँ से लिख के भेजते हैं।
So can you write some notes? Can you do the transcription or write some notes? Okay, we'll share in the group, Dr. Parimita.
अध्याशा जो है वो लिख के दे देगी।
Okay, Dr. Adyasha, you can also even you can write it on paper and pen, and you can just take a picture and you can submit it. because we will have the response of everyone, in whatever way. It's not all, if it is not getting sent by your system, you can record it, like you can write it with a paper and pen, and you can post it in the group.